Hello, my name is Laura Jensen. I'm here with Dr. Scott Durgin, who's a medical doctor and who's board certified in lifestyle medicine and is the director of lifestyle medicine at Springfield Medical Care Systems. Thank you, Dr. Durgin, for being with us today. I know you're a busy clinician.
My pleasure.
So lifestyle medicine is relatively new in South Central Vermont. Can you talk to us about lifestyle medicine and how lifestyle medicine uses food to address health concerns?
Sure, I'd love to. I guess I'll give a little bit of history just on lifestyle medicine and where it came from and what we're trying to do with it, and answer the question that way. The lifestyle medicine had its first physician boarding in 2017, so it's a relatively new field. And what we do is use evidence-based practice to address the vast majority of chronic disease. And the things we try to address chronic disease with are food, exercise, sleep, stress management, relationships. And so the same sort of science I used as an emergency medicine doc, we'd use to help reverse heart disease or treat or prevent heart disease. I think the incredible power of lifestyle medicine is that we can often prevent, treat, or reverse, and the reverse is a big deal, disease. And so I went through a pretty significant personal transformation as an emergency doc and ended up finding lifestyle medicine through those transformations. And I'm very passionate about it today to try and bring that option to patients today. We in medicine have been very, very good at treating infectious disease and traumatic injury, and that's certainly what I learned a lot about in going through medical school. And then residency and medical practice. What we seem to be have an area for improvement is chronic disease. And we know that the vast majority of chronic disease, up to 80% plus, is directly related to those choices I mentioned: food, sleep, exercise, stress management, relationships, toxins like tobacco or alcohol, drug abuse. And we know that at least 80% of healthcare dollars are spent on chronic disease. So it is an incredibly important area that I think we need to spend more focus on. In terms of specifically how we might use nutrition, I naively thought as I got into lifestyle medicine that I would just need to tell someone the foods that are wonderful and that would help treat and reverse, prevent disease. I was wrong. The knowledge is a wonderful starting point, and certainly we help people identify foods that are creating damage and disease in the body, and those that help prevent and reverse disease in the body. But it's the behavior change and meeting that person where they're interested in changing and helping them make those habit changes that's actually the cornerstone of lifestyle medicine. Because we often already know we should eat better or exercise better. We often don't have quite the specifics on how to do that, but then how to incorporate that into a busy, stressful life with all sorts of factors. So we spend a great deal of time, much more than you'd traditionally spend with a physician or healthcare providers. We often spend upwards of an hour every week or two for several months getting to know and helping a person actually do these habit changes. I think that's a fundamental change from how I practiced emergency medicine, where I might see someone once in my life, identify a problem, prescribe a medication or a procedure, and that would be it. So using that nutritional knowledge is the most important step we have in lifestyle medicine. We use it's not just me. Lifestyle medicine uses a variety of tools, psychologists and wellness coaches and trainers, and teaching folks how to cook and shop and store food. These are all critical elements to helping someone address nutrition to try and often we're addressing those incredibly common chronic diseases like high blood pressure, cholesterol, diabetes, heart disease, anxiety, depression, and nutrition is a cornerstone to the root cause of those diseases, and those diseases will not go away until we address the cause.
Can you give us an example of a specific condition like type 2 diabetes, for example, and how food can reverse type 2?
Sure. So diabetes is actually an issue with chronic insulin resistance. And so insulin is a compound in your body that kind of unlocks a doorway, so to speak, into your cells to allow glucose to enter, blood sugars to enter. As we develop insulin resistance, that doorway kind of gets sticky. It's harder and harder to open. And so our body continually produces more insulin. And as it does so, we actually develop even more resistance to that insulin. In addition, insulin doesn't just work on glucose, it also deposits fat in our fat cells. And what we're learning is that the wrong types of fats, particularly things like saturated fats, which are mainly found in animal products, tend to make that door very, very sticky. And it's not only the fat that we eat, but also the fat that we wear. So that insulin depositing more fat is a big deal. And so learning about those foods to not only keep insulin spikes down in the first place, but also foods that won't lead to this insulin resistance it's critical for reversing diabetes. Otherwise, we're only going to continue to develop more and more insulin resistance and thus need more and more insulin to make it work. Well, at some point, your body gets tired and it'll stop producing insulin. And more cells will die and the disease snowballs into uncontrolled diabetes. And so this is where learning about those foods that don't create insulin spikes, that don't have that the more dangerous fats in them is critical. And then there are other foods that help lower insulin resistance and help minimize any damage that would occur from some of the fats that we would eat.
So thank you, Dr. Durgin, for sharing your expertise. And we're very lucky to have you in South Central Vermont.
It was my pleasure. Have a good day.